Hello and welcome to this week's episode of Giant's Healthy Innovators TV. I'm your host. My name is Barry Shrier, and every week we bring to you leaders in innovation and technology and healthcare to share with us their expertise and to help you understand what's happening in the world of healthcare, what some of the biggest challenges of society are, and how we're tackling those for the benefit of everyone. Our vision is to improve the health and the well-being of people around the world by accelerating innovation and technology in healthcare. So today I'm very happy to bring to you some very interesting international people from Laureate Consulting. We have Anna and Alistair and Verena. Hello everyone, nice to see you guys. Thank you for joining us.
Hi there.
So what I'm going to do is I'm just going to go around the room and ask you guys to introduce yourselves briefly. And then what we'd like to do is talk about some of the key issues in healthcare and society. And we'd love to learn about what you guys are doing. And also, I'd like to mention that Laureate Consulting is a sponsor of Giant Health. So you'll have the opportunity to meet them in December in London, England at the Giant Health event this year. For more information about that, obviously go to the website, www.giant.health. We invite everybody to subscribe to this video. And if you like it, please like the video. And we look forward to hearing from our sponsors, Laureate, throughout this conversation. If you have any questions, if any of our viewers want to engage with Anna and Alistair and Verena, you'll have their contact details at the bottom of this video. So we invite you all to reach out directly to them. Good. So Alistair, again, great to meet you. Thank you very much. And if you don't mind, if you can introduce yourself and just tell us a little bit briefly about your career and your areas of interest.
Sure. Hi there, Barry. As you said, my name's Alistair Walker. I'm the owner and a consultant at Laureate Consultancy. A consultancy I started 10 years ago, but prior to that, I spent 25 years working in development at different levels. So from an engineer up to managing teams, and that was in 3 different industries. So I spent about 15 years in the medical device sector, but
Nice.
also some time in the aviation industry. And the last position I had in development was with an automotive company.
Wow.
And this was a lot of the thinking behind setting up Laureate Consultancy.
Excellent. We actually believe that innovation is extremely important in healthcare, and in particular, a challenge in healthcare is the so-called cross-fertilization. What innovation has happened in automotive or in agriculture or in retail that can be brought into healthcare. So glad to hear about your background in different industries, which I'm certain makes a difference for your clients and for healthcare providers. So looking forward to hearing more about that. Thank you.
Great.
And likewise, Anna, good to see you. Thanks for joining us. If you can introduce yourself, please.
Thank you for having us, Barry. My name is Anna Georgievich, and I'm a business development and marketing manager at Laureate Consultancy. So I'm doing everything with our customer base, and I'm identifying new business opportunities and deal a lot with different marketing activities at Laureate. So I'm doing everything around our consulting and training sessions at Laureate.
Excellent. Thank you. We're glad to have you on board and looking forward to our conversation and working with you further. Thank you. And likewise, Verena, nice to meet you. Thank you for joining us.
Thank you for the opportunity. My name is Verena. I am the medical device consultant, and I started my professional career 8 years ago as a software engineer for a medical device company.
Wow.
I was mainly involved in big data applications for this company. And after several years, I decided to switch my focus, and I started for another company in the quality management and regulatory affairs department, and was working there for 3 years as a quality manager and regulatory affairs manager. At Laureate, I support our customers in various projects, but I also provide trainings about different regulations.
Excellent. Thank you for the introduction. And again, welcome. We're really glad to have you joining the conversation today and looking forward to it. So let's begin, please, Alistair, with you. What are examples of big challenges in society or in healthcare that relate to medical devices, that relate to software? Can you bring out any big themes that you think would be interesting for our listeners around the world and that would be good to discuss today?
Yeah, absolutely. I mean, probably The biggest topic, I would say, is the way that risk management is addressed in the medical device sector. There are some, I would say, noticeable differences potentially between the medical device sector, for instance, to the automotive sector, to the aviation sector.
Okay.
So, although there are pros and cons in any industries, that's always something that you think, well, a little bit more rigor, a little bit more focus could be applied in the world of risk management around medical devices.
Okay. No, that makes a lot of sense. Often I'm invited to give keynote speeches at conferences, and I like to stand up on stage and say a little bit of a joke, but with an important truth behind it, which is that I'm glad my GP doesn't poke me with some startup widget that she bought yesterday. And so these issues of risk and regulation and effectiveness and safety are absolutely paramount in healthcare, aren't they?
Absolutely.
Maybe not so important if you're retailing fashion or something like that.
Yeah.
And so do you want to give us an example, or do you want to elaborate a little bit about, well, what is risk when it comes to software and devices?
I mean, I think it's one of these things that often comes down to the classification of product. So many medical devices are not potentially that dangerous, but some are. So
Right.
the level of rigor that needs to be applied in terms of the analysis techniques that are used, making sure that the residual risk is acceptable before the product is launched is key. And that's something, as I say, that maybe could do with a little bit of shoring up in the medical device sector for higher classification products. But it depends who you're working with as well. I mean, we have worked with a lot of US customers, and we have a lot of dealings with the FDA. And the FDA, you often find, are very rigorous, and their approach to it is actually very encouraging. So it depends on market and depends on the criticality of products.
Okay. A lot of our listeners from around the world are working as clinicians, for example, and some of them are advisors to companies. And a lot of our listeners are themselves entrepreneurs developing new products and services. Just in case some of our listeners don't have the expertise that you guys have, could we step back for 1 minute and just talk about levels or categories, as you said, of devices? Maybe if we could just have a very brief summary of those in a few jurisdictions.
Yeah, sure. I mean, if you're looking at something like Class 1 products, you might be talking about, things like sticking plasters or whatever. Class 2 products, you might be talking about ECG recorders, and this is focusing on the US at the moment. And then Class 3 products, you'd be talking about things like dialysis machines, things that are used in intensive care wards.
Okay.
And then you get different classifications across different markets. So in Europe, you have a 2A and a 2B. In Canada, Brazil, you then have a Class 4. So you have different, but the scale from 1 upwards is comparable across the globe.
Yes. Yeah. Okay. No, that's a helpful clarification. Thank you. I think our listeners will benefit from that. Anna and Verena, let's also include you, of course, in the conversation. So do you guys, Anna, for example, what are examples of the services that you're offering to the world, and how does that help them? Why do they need your services?
So in our consultancy and trainings, we are concentrating on such topics as functional safety, regulatory affairs, and quality management. Our services consist mainly of 2 parts. The first one is where we function like a part of the team or external consultant. And the second part is where we help our customers to deal with complexities of various safety standards.
Brilliant. No, that I can imagine this is an incredibly big challenge for every business, and it's one that they don't necessarily find easy to have the in-house expertise. So that's really interesting. And Verena, what's an example of a customer? You don't have to name them, but what's an example of a project or a challenge that a customer has, and how you guys approach that?
Yeah, we had this one customer who had really an innovative software developed, and the software was really borderline between medical device and non-medical device software.
Okay.
And they were advised by another consultant to go the medical device route. So when we started our consultancy with them, the first thing we did was to establish this intended use statement together with the customer, of course,
Okay.
and to perform the regulatory assessment, determining the general safety and performance requirements, and also the classification Alistair talked about.
Yes.
During one of our status meetings, we talked about the findings in the regulatory assessment, and I just mentioned in a side note that they are so borderline, so when you choose not to be a medical device, they can go this route too.
Oh.
And the customer was really surprised because he was not aware that only his claims or references to a specific medical conditions made him fall under medical device regulations.
Yep.
And the device they provided or the software they developed is really useful for healthy people too. So I tried the software, and
Okay.
it really improved my daily life activities too.
Wow. Wow.
And
As a medical device or as outside of medical regulation?
yeah, just as health software, making yeah.
Well,
t-
that's
uh,
interesting. Yeah, no, thank you very much. Alistair, if I can just play devil's advocate, if you don't mind, just to challenge you guys to kind of tease out some stronger understanding. Let's say hypothetically, I have launched my business. I aim to create something which is like what Verena just mentioned, where maybe it's not absolutely clear if it falls within regulation or not. Why can't I work that out on my own? Why can't I make regulatory applications on my own? Why would I need you and your team to work with me instead of me just doing this myself?
Sure. No, good question. Well, I mean, it's down to experience. If you've worked with numerous medical devices over the years, you've encountered these challenges or most of these challenges already.
Yes.
So then you can bring experience. And the important thing is, it's very much like this in our training courses as well. People say, well, why do you need to bring in a training organization? You could read the standard yourself. But
That's a good point.
either if you're talking about consultancy or training, the practical experience, the knowledge, hands-on experience makes a huge difference. So yes, other people could maybe find their way through that maze, but if you bring in an external organization, it may cut the time down to maybe a quarter. So ultimately, it comes down to saving time, money, and also gaining extra experience they might not otherwise have found.
No, it's a very, very good point. Naturally, if they don't have all of the background expertise and experience that you and your team have, they might think, well, I can do this myself, but why should I? And as a founder or business leader, surely they should be doing other things which they're good at, whether it's sales, marketing, customer relations, product development, whatever, as opposed to attempting to become an expert in the area that you're an expert in.
Yeah. And then we all have that problem as a business owner as well. It's making sure that you delegate responsibility and activities to the team. So
Well, exactly.
the reason that three of us are here today.
Yeah. No, it makes a lot of sense. Yeah, thank you. Anna, do you guys work in a particular geography only? Are you focused on the US only, or do you have ambitions or activities in other geographies?
So usually we have lots of ambitions in our business.
Excellent.
And from 2020, we started to enhance our online presence. And in March 2020, we presented our first online training.
Wow.
So the pandemic time was pretty challenging, but at the same time, it gave us lots of opportunities to reach our clients throughout the world. So now our geography is really huge. We have lots of clients on different continents, starting from European countries till the US and Australia.
Yeah.
That's great.
Excellent. Yeah. I guess the online services naturally are, by definition global, and therefore that's a good opportunity for scale, isn't it? Yeah. What has the pandemic done in terms of your customer base, the services that you provide? Has this created new opportunities for you, or has it created a lot of problems that you're struggling to overcome? Don't misunderstand me. I'm not wanting to be nosy about your business or your performance, but I'm just curious to know about the pandemic and what has this done in the world of healthcare and regulation and medical devices and software and things like that. I suppose an example that I'm thinking of is how in the pharma industry, as you know, vaccines that took years and years and years and years and years to crawl their way through regulatory process were fast-tracked because of the pandemic. However, as the pandemic has, I don't know, how do you say it, subsided, although the virus and its mutations are still out there, people are saying, well, how do we avoid going back to our bad old ways of 4 years ago, where it took 10 years to get a vaccine approved, whereas we know we can get vaccines approved in 1 or 2 years. Anyhow, I'm just reflecting on some of these conversations in the world of healthcare, regulation, innovation, and I'm curious to know what your experiences have been.
Anna, do you want to answer that?
So as I have already mentioned, I don't know if Alistair, you will add something. First of all, it's like we understand the importance of being more present online. As for now, we are very active in our social networks, for example, LinkedIn.
Oh, wow.
We write really valuable blog on our website.
Yes.
So it's one of the ways to reach the clients, and it proved to be very effective. The time before pandemic was also successful, but usually it was mainly like offline trainings somewhere, and like we spent pretty much time on business trips, and now it is like much quicker and easier to provide our services.
Well, absolutely. Yeah, I mean, that makes a big difference, doesn't it? I think we all spent an awful lot of time traveling, didn't we, before the pandemic? And we all spent an enormous amount of time directly visiting potential customers and customers face to face. And it seems necessary back then. And now it doesn't seem so necessary. And so
it's the same effective.
Yeah, I'm glad that our customers don't say to me, well, can you come to Berlin for a 1-hour meeting tomorrow?
And it's also ecologically friendly.
Oh, that's a very good point. So in that respect, we have these benefits, don't we? Of enabling all of us, I hope, to lower our carbon footprint. What about regulation, Alistair? I don't want to say have regulations been relaxed, because obviously no one wants that necessarily. But did the pandemic have an impact on the regulators and their timetables? Or I don't know, I'm wondering about these things.
Not really. I mean, there have obviously been changes in regulation in Europe in the last few years that have basically highlighted problems that you can't necessarily fast track things. And that's happened in the UK recently as well. The fact that CE marking was going to be phased out, it has now been prolonged that CE mark products will be accepted. So I think it's shown that setting up the infrastructure to approve and regulate products still brings in a major challenge. So, but from our point of view, where we do the majority of our work around hardware, software, and so little really has changed in that area. It's pretty much as it was before the pandemic.
Oh, that's interesting. Yeah. Are we allowed to mention Brexit, or should we avoid that and delete this part of the video?
No, you can mention it. We are, as a company, Brexit proof, if you want to call it that. We are not one company, we are two companies. We are Lloyd Consultancy GmbH and we are Lloyd Consultancy Limited. So we have a presence in both markets.
And does this create new opportunities for you? Because obviously there's, what's the word for it? I'm not an expert in this area. There's evolving regulatory landscapes. Is that correct?
Yep. Yeah. I mean, the interesting thing, and as Anne was mentioning there, that when Corona came along and everybody started working at home and online, we have found customers in Latvia, Lithuania, Egypt, and we've had markets that we never had access to
You're
before.
kidding.
Yeah, yeah.
Because what? They found you, or everyone's stuck at home searching, or
Yep.
everyone's willing to do stuff online, which they weren't willing to do before.
Exactly.
How did they find you, or how did you find them?
I think it's a lot of hard work from Anna, a lot of promotion online, a lot of
Nice.
advertising.
Yeah.
And that brings people to you. I mean, obviously the holy grail is getting on the first page of Google.
Of course.
The first page of Google, then people will find you.
Yeah. So am I allowed to ask Anna to come work for Giant Health and to No, pardon me for being cheeky, but this is very interesting. I mean, people moan about the virus. Obviously, it was a terrible tragedy for many people around the world, and yet there are these, what do you want to call it, these results of innovation and openness and going online and digital and reduction in the need for face-to-face meetings, and all these things are good, I think, for us. And Brexit obviously hasn't hurt you. You've adjusted your proposition and your structure according to whatever the requirements of your customers are after Brexit.
I think the problem now, though, is since the coronavirus, we've had so many training courses and so many companies in the US. So then you start thinking, well, where do you stop?
What do you mean?
Do we set up an Inc. as well?
Oh, I see what you're saying. Oh, so it might benefit having an American company to offer the training.
Well, you start thinking, where do we draw the line here?
No, that is tough. I get you. What are examples of some of the training programs? Do they fall into categories? Are they chapters in one area, or are they lots of different themes or tasks?
Well, let Verena answer that one.
Yeah, thank you.
So we never have held a training course twice. So there is no structure. Of course, we have our building blocks we put together, but before every training, we ask our customers about their experience level and also for specific topics or questions they want to have addressed in the training. So last week I held training with a company. They wanted to have our IEC 62304 standard training. The IEC 62304 is about software development in medical device sector, and they specifically want to talk about artificial intelligence development, and therefore we adapted this training to artificial intelligence.
Wow, excellent. No, that sounds incredibly interesting and important, obviously. Naturally, everyone's talking about AI these days because of the recent launches earlier this year and end of last year with the new LLMs, the large language models. And I guess you have to add AI to your business plan if you're pitching to investors, whether there's any machine learning in your business or not. And so this causes a lot of challenge for regulators, doesn't it? How do you define a product if the product is constantly changing due to input from machine learning? Is that correct? Or what's the issue? And B, how are regulators approaching this?
I mean, there are a series of standards that have come out in the medical device sector around artificial intelligence, machine learning. But the problem is, and it still remains, is bias coming into data sets that are used for training models, bias in the models themselves. And one of the facts that's well recognized is that finding matrix that you can use for artificial intelligence is also quite challenging. So we're getting there, I would say. We're beginning to talk about it more. We're beginning to publish numerous documents on risk around artificial intelligence, but it's not the finished article yet. There's still a bit to go on that one.
Does this present a challenge for your clients, and is there a need for you guys to be in the middle of this conversation, or is it not really part of your business?
No, that's a very common scenario. And Verena has been working this year with a customer in London who produce an app for detecting melanoma. So that's another example of an AI app, and that's a very common type of application nowadays.
No, that's extremely interesting. Obviously, there's a big, what do you want to call it, fear of black box with
Mhm.
AI, isn't there? Where, well, we don't know how did it come up with the decisions that it has made and the outputs from that. And I can imagine that's it's going to be an ongoing challenge for regulators, isn't it? And therefore, I guess good for the experts like yourself who are in the middle of this conversation and understanding.
Yeah, I mean and data sets, play a very big part in this. But if you look at the automotive industry, as I say, we work in more than one industry.
Yes.
There have been cars driving around in California for years now, gathering data and building up data sets. But when you consider the number of problems that can occur, like leaves blowing over the road, and the car doesn't know what to do with that, or there was a classic example of two women on a corner speaking to each other, and the camera picked up the back of one woman and the head of the other woman, but they're about a meter apart. And the car thought about it for about 5-10 seconds before it decided what it was going to do. So, artificial intelligence, machine learning, there's so many things you still have to learn and train into products.
Yes, that's fascinating. And I guess an example of how unbelievably complicated and capable the human brain is, and
Yeah,
how maybe we're only scratching the surface in our understanding of it, let alone understanding the capabilities of machine learning and so forth. Um,
exactly.
yeah, no, that's very interesting. Well, I hope surgeons in the operating theater can recognize the head of one person from the body of another.
Hopefully.
un- Unlike the computer-driven car in California.
Yeah.
But look, we don't have too much time. We'll want to maybe wrap up in the next 5 or 10 minutes, if that's agreeable with you guys.
Mhm.
Alistair, are there any particular case studies of work you're doing with customers or examples of where your business is headed that you'd like to share with us? And likewise, if you wish Verena and Anna to contribute, please.
Yeah, yeah, absolutely. We've had some very interesting projects over, say, the last 4 or 5 years, very much so. I'm A lot of the stuff we do is around safety, and
Okay.
we've talked about artificial intelligence, but we have recently been working on a number of projects where robots are used for operations, and then the use of and that also brings a bit of artificial intelligence into it. But the whole concept that a robot has to stop when it's supposed to stop and doesn't continue proceeding through the human body is
Yes.
an important point. So that's been a very interesting area for us. As mentioned, Verena could probably tell you a little bit more about the app for melanoma, skin cancer. And there have been a number of other products that are quite innovative, a lot of endoscope products, and really just how small you can make such devices, because they obviously have to be. So we've had quite a number of, I would say, quite interesting projects and cutting edge projects over the last 4 or 5 years.
Excellent. No, it's great to hear about the variety of businesses that you guys are involved in, and I think our listeners will value that to understand further about your capabilities. So, Verena, the melanoma, what is it, diagnosis business, what were their challenges that you guys are helping with?
So we were involved in their internal audits. So they asked us to perform their internal audits for them, and
Okay.
we splitted the audits in two phases. One was this classic quality management stuff, and the other one was more focusing on software development, risk management, and usability issues. And just, I think, 2 weeks before we started with the second phase of the audit, they approached us and asked us or told us that they are not happy to have an audit on these topics because they know they have some issues to clear and think about. And they would appreciate it if we do not have this classic audit situation where one asks questions and they give answers and the auditor notices the non-conformities they are already aware of.
Yes.
And therefore we conducted the second audit in terms of a workshop where we talked about the requirements of the specific standards in the teams, and we searched for solutions together, and we made sure that everyone in the team is aware of what the requirement actually wants them to do or what is expected from them to implement in their product and in their processes.
Excellent. Yeah, no, they're very interesting. How does a company know it needs you? I know that might sound like a strange question, but I suppose almost by definition, they might not have a deep enough understanding of the territory they're stepping into or are in already.
It's a very common scenario that people will often look at the appropriate international standard. Verena's talked about 62304 for software, the 60601 series for safety, and there's 14971, which is risk management. Quite often people look at that and then they have an internal discussion and then they say, I think we should get somebody in to help. And that is quite often how it pans out.
Yes.
And very often our training participants come to us for consultancy. It's like a pretty often scenario.
Well, that's interesting. So in a way, the offer of training helps you guys begin to engage in a relationship with businesses, first with training, which could lead to, of course, them realizing that they may need additional services and consulting from you guys in terms of your expertise.
And sometimes the other way around. Sometimes you start consulting with somebody and then they think, oh, well, maybe we could benefit from a training course. So
Nice.
that has happened a few times as well.
Nice. No, that's a good synergy, isn't it? Did you guys begin, Alistair, with one service only, like consultancy, then you bolted on training, or the opposite, or did you launch both of those together?
We started as a consultancy in 2014.
Okay.
Then in 2017, we started running training courses. And we're also looking at other services. We have this year started to offer an EU representative or a UK representative for regulatory affairs. So that means people who are in the UK that want to sell products in Europe,
Yes.
then they can come to us and we can be the official EU representative. And that's something Verena has been very busy with as well over the last few months.
Yes. Well, I can think of several hundred companies coming to Giant who are based in the UK who are struggling with getting into the EU. So sounds like a marriage made in heaven, as they say.
Yeah. And it's also, I was about to say, it's also panned out that we've got US companies coming to us for that service as well.
US companies who want to trade in Europe or trade in the UK.
And trade in Europe. So we've got a couple of companies that we're working with at the moment.
Nice.
Who want to launch our products in Europe and obviously want support in doing that.
Yes, exactly. And are most of these businesses software, or are you involved in hardware and things like this also?
It's a mixture of both. So Verena, her background is predominantly software. My background was more hardware, and we do systems, software, and hardware support. That's part of our service.
Yeah, excellent. Hey, we'll look at, I wish we could continue this conversation for another hour or two because it's very interesting and it's so important. It's at the center of tech innovation in healthcare, making sure that businesses get it right, making sure they understand the regulatory environment they're operating in and getting the right advice so that they can move forward successfully without themselves having to get too distracted in becoming regulatory experts like you guys are. So I found this incredibly interesting. Alistair, how do companies get a hold of you? What's your website address, please?
Sure. It's Lorit-consultancy.com. So,
okay. And Lorit is Lorit.
Which is interesting. It is the German spelling of to roll backwards. So the company the company is actually Tyrol Consulting.
Oh, okay.
It is Laureate is just Tyrol spelt backwards,
Oh,
because
excellent.
I lived for 2.5 years in Innsbruck, and
Okay.
that's where the name for the company came from. And the irony is, after almost 9 years, Verena joined us, and she lives in the Tyrol. So we've actually got a genuine person from the Tyrol in the company.
Oh, excellent. Oh, a good coincidence. But I've really enjoyed this conversation, and we're grateful for your time. This has been very interesting, very informative. I'd love to invite all of our listeners from around the world to contact Anna and Alistair and Verena at Laureate Consulting. There'll be links at the bottom of this video for you all to learn more. We also would like to remind all of our viewers and all of our listeners from around the world that Laureate is a sponsor of Giant Health, and you'll be able to meet them at the Giant Health event on the 4th and 5th of December in London, England. For more information about that, obviously go to the Giant website, www.giant.health. So once again, Alistair and Anna and Verena, it's a pleasure to meet you guys. And this has been an incredibly interesting conversation. We're excited about building a partnership with you. So perhaps early in the new year, maybe in January, we could do another episode and talk to you guys about latest case studies, talked about how your training programs are developing and so forth.
Sounds great. Excellent.
Thank you for having us. Thank you.
Yeah, thanks everybody. Great to have you on board, and we appreciate your time and your incredibly interesting and valuable work in healthcare. So thank you very much.
Thank you very much.
Thank you.
Thank you.